Okay, hi, it's Dr. Buford. We're just getting started on your right shoulder. We examined your shoulder before we started and just confirmed that you do have instability both to the back and to the front. And now we're just taking our first look around inside the joint. This is your biceps tendon on the left. It looks good. The biceps insertion we always look at because sometimes the labral injury extends all the way up here, but this actually looks pretty good. So you do not have a slap lesion. We can look up at the rotator cuff. Remember we talked about the rotator cuff because the radiologist was concerned about it, but the rotator cuff here looks perfect. That's the supraspinatus. As we get back here, we get more into the infraspinatus portion of the cuff. And that cuff and posterior capsule look great. You do not have a significant injury to the back of the humeral head. So we talked about a Hill-Sachs lesion. You don't really have a big one. You have a normal bare area, but I do not see a big Hill-Sachs lesion. So that's also good. Also confirms the MRI findings. And then as we pull back here and look towards the front, there's a couple anatomical things to point out. Just to the right of that blue cannula, that's the middle glenohumeral ligament. And we can see that inserting into the labrum here. So that MGL, we call it for short, looks good. If we push down on it and look up to the left, going above, rotate the camera a little bit, going above the blue cannula, that's the leading edge or the superior edge of the subscapularis tendon. And that also looks good. So now as we look down the front of the shoulder, we'll see how much of a labral detachment you have versus just ligamentous laxity. The second fold, that little band you see there, that's the anterior band of the inferior glenohumeral ligament. That looks good. The labrum is here. It's not that damaged. So really, I think the overall issue that you're having is what we expected, just the looseness in the ligaments. This is the posterior shoulder. Here's the posterior labrum that's kind of rounded off. And we can see the posterior capsule inserts very medial on the glenoid. So as we pull back here a little bit, I'm suspecting that the glenoid, the socket here, is going to look like a little island. And sure enough, you can see how it kind of sits there like an island because the ligaments are so loose. And so that's what we're going to work on. You can also see how the humeral head's a little bit inferiorly subluxated in this position. And as we pull it back in joint, or not in joint, but just pull it back in a more reduced position, it's centered over the socket. So this is the typical appearance of a shoulder that has multidirectional instability. We're going to get to work tightening the ligaments. The first step for us is to go ahead and put our camera in the front, and we're going to work in the back of the shoulder first. So we'll go off on the video. Switching sticks. Do you have a solid one? Okay, so we're using this instrument. It's called a RAS because it has these kind of ridges on it that allow us to gently roughen up the soft tissues here. And we're using it back in this region just to roughen up the capsule and the labrum, trying to make it sticky like Velcro basically. And next we'll take a spinal needle and we're going to just check our angle to place an anchor down into the glenoid back here. Lift straight up on the arm just for a little bit like that. So it looks like we want to get our first anchor down right about here. We'll go ahead and get to work on that. Crochet hook. Okay, so we've got our first anchor in. You can see it right there. The black and white sutures, it's very solid. We're going to reach in here and take out pincher tool, please. The pincher, like the crab claw looking thing. We're going to reach in here and take out one of the sutures anteriorly. We're looking from the front towards the back. So we're going to reach in, take this one suture, we're going to pass it to the front like that. Okay, and now we're set to put a grasper in the front. And then we'll use what we call a turn to the left suture hook in the back. Okay, so we're going to have you hold the camera for a minute. We'll show you what the suture hook looks like. It looks like this. It's loaded with a black wire called the super shuttle. I got it now. And so now we're going to do this stitch basically by planning where we're going to end up, which is right about here, and then just rotating back into the capsule. Shifting a little bit inferior. Lift straight up on the arm, please. Okay, so there's our first bite. And then we go under the labrum here. Okay, so here you can see as we pull back on the wire, see how it's got that stitch with it? And that's how we pass the sutures basically through a straw, you know, through these little cannulas, these blue cannulas you see. So that's the first pass. We're going to do what's called a figure 8 stitch, which is a special type of mattress stitch that I think is a little bit stronger and will help you a little bit more given the looseness in the ligaments that you have. So we're going to take this suture and we're going to pass this suture one more time. So I need a crochet hook again. Okay, can you reach the camera from here? And sometimes we just hand it off to ourselves just like that. Okay. And now we're going to do the same thing one more time. And once again, here's our first pass. This is sometimes called the pinch part of the stitch. And then, like we showed you before, we're going to try and get this underneath this labrum here. Just like that. Show you some more in a minute. Okay, so there's that first stitch tied. You can see how it looks kind of like an 8. That's why we call it kind of a figure 8 stitch. It's a particular type of mattress stitch, and it's tightening the posterior band of the inferior glenohumeral ligament. And so now we're going to look at the front of the shoulder and decide how many anchors we need to put here. I'm going to take the rasp first. Back this cannula a little bit. I'm going to slip back around the biceps tendon. It gives us a little more room to work down the front. Okay, we'll show you some more in just a little bit. Okay, so here we've got another suture anchor in. You can see how this is just in front of the ligament there. The ligament is coursing off to the left right there. So we're going to tighten that up. We're going to take a crochet hook. We're going to take a turn to the right suture hook. And we'll get to work on tightening this up for you. Okay, so what we're looking at here is the first stitch in the front. That's tightening up that. We're going to place another straight guide, so not the green one, the other blue one. We're going to place another anchor just superior to, take out the, just superior to that. You'll see the guide come down. There it is there. And so we're going to place another anchor. You have a small glenoid, which is not surprising because you're petite. We're going to place another anchor right about here, and that takes us right up pretty much where we need to be. So I think this may be the last anchor we have to place. Okay, so we've tied the second one. You can see how it really bunches up that anterior capsule and tightens up the ligaments in the front. The ball looks like it's centered over the humeral head. And again, with the size of your shoulder, I think we might be done. Sometimes we put 3 in the front on a larger shoulder. I'm going to put the shaver in just to help us irrigate out the joint and make sure there's nothing else to worry about here. But that sure looks good from the front. Perhaps we'll take a quick peek from the back before we finish up here. Okay, so we're taking a quick look from the back to the front. Cuff looks great. Biceps tendon looks good. superior labrum looks good. Again, I don't think that's a slap lesion. That's just what we call a sublabral foramen. That's normal anatomy. There's our sutures in the front. It's going to be hard to see in the back because we've tightened that up too, but there you can see how much tighter it is compared to when we started. That capsule is really right up against the humeral head right now, so that's good. So I think we're going to finish up. The final check is we try and see if we can look at the glenoid. Remember at the beginning of the case it looked kind of like an island, and now I'm pulling back through the cannula and I still can't see back here, so I'm happy with that. So we're going to finish up, get you back to recovery. Good luck to you now. Bye-bye.